So the role of social science in a project like this is absolutely key, because if we do take a One Health approach that puts at the heart of our consideration the household and the communities that are affected by these health issues, then it can never just be about the science. It can never just be about pathogens, but it's also about how individuals and how households perceive these, how they manage them, and how they look for ways to improve their health outcomes. The social scientists and SEEDZ therefore are actually talking to people. We do some quantitative social science, which is to ensure that we get a wide range of views and understandings, which is usually done through survey work. But perhaps what's more important and what's more innovative about this project is that we're also using more qualitative approaches, which involves listening to individuals and groups of people in focus groups to understand the processes that they go through in terms of making sense of health options and making sense of diseases that they deal with. The value of qualitative work became apparent quite early on in the project. When we'd asked people in the survey, in the household survey, if they boiled their milk, the vast majority said yes. And so we couldn't quite understand why brucellosis was still as prevalent in these communities as it is, because brucellosis is a disease that's transmitted through raw dairy products. So we wanted to explore this further in the focus groups. And after we asked again if people had boiled their milk, again the vast majority said yes. We then asked about particular types of dairy products. A local product is mtindi, which is a kind of yogurt. And we asked if people boiled their milk if they were making yogurt. And the vast majority said no. And seemed surprised that we asked. For them, there was no connection between milk and yogurt, even though the yogurt was simply milk on the whole. The yogurt was simply milk that had been left to go off. We later discovered that in these communities around 85–90% of dairy products were consumed as mtindi. So what this very simple example highlighted, that by exploring people's behaviour, giving them the opportunity to discuss it rather than just asking a very closed question, we actually get much more useful information. People weren't lying about boiling milk. They do boil milk if they're consuming it as milk. But when they're consuming it in a different form, it's not boiled. And so that started to give us an insight into where perhaps some of the risks of transmission of this disease might be coming from.